Hello, in this video I'll try to answer frequently asked questions about ADDERALL XR. If you find this video helpful, don't forget to like and subscribe to support the channel. What is ADDERALL XR? ADDERALL XR contains two active ingredients, amphetamine and dextroamphetamine. These substances stimulate the central nervous system and increase levels of dopamine and norepinephrine, which enhance focus, attention, and wakefulness. ADDERALL XR is commonly prescribed for Attention Deficit Hyperactivity Disorder, ADHD, Narcolepsy, a neurological disorder that causes sudden episodes of sleepiness. How to use ADDERALL XR? Before starting, always consult your doctor before beginning treatment. Your heart rate, blood pressure, and any existing mental health conditions should be evaluated. Dosage information. Adults for ADHD. The usual starting dose is 20 mg once daily in the morning. Dosage may be increased by 5 to 10 mg weekly if needed. The maximum daily dose typically does not exceed 60 mg. Children 6 to 12 years start with 5 to 10 mg in the morning. May be increased weekly depending on response, up to 30 to 40 mg per day. Adolescents 13 to 17 years start with 10 mg in the morning, which can be increased to 20 mg after 1 week if necessary. Administration tips. Capsules should be swallowed whole. If swallowing is difficult, the capsule may be opened and its contents mixed with a spoonful of applesauce. Consume immediately without chewing, then drink water. Take it at the same time every day, preferably in the morning. Taking it in the afternoon or evening may cause insomnia. It can be taken with or without food, though food may delay its effect slightly. Missed dose. If you forget a dose and it's still early in the day, take it. If it's late, skip the missed dose and continue as usual the next day. Who should not use ADDERALL XR? You should not use this medication if you are allergic to any of its ingredients, you have serious heart conditions, you have glaucoma, you are currently taking or recently took MAO inhibitors within the past 14 days. You have severe anxiety disorders. You have uncontrolled high blood pressure. Common side effects. The most common side effects of ADDERALL XR include decreased appetite, weight loss, trouble sleeping, insomnia, headache, stomach pain, dry mouth, nervousness, anxiety, mood swings, nausea or vomiting, dizziness, fatigue, fast heartbeat. I hope this video has helped clarify everything you wanted to know about ADDERALL XR. If you found it useful, please give it a like and subscribe to my channel for more informative content. Stay healthy.